Hello, everybody. Welcome to the Practice Pulse podcast with me, Dr. Aditi Agarwal. I am a general dentist and also co founder of Practice by Numbers. And I have the pleasure of talking today with Dr. Tina Saw, who's a really good friend and also a serial entrepreneur. So, welcome to the show, Tina.
Hi, Aditi. Thank you so much for having me. I feel I feel honored to be on your podcast, and I feel like I'm just talking to a friend. We've been friends for such a long time, and we've been through our entrepreneurial journeys together from the very beginning.
Yes, exactly. We both have shared our struggles together, and it is so good to sit across from you and actually share our journey, or at least for today, your journey with with the world at large. So, a little bit about Tina, with with over 15 years of experience in the dental industry, Dr. Tina Saw holds a DDS from Loma Linda University School of Dentistry and a BA in biology from Case Western Reserve University. As an entrepreneur and dentist with a passion for philanthropy and a drive to build health equity, she has founded multiple companies, not just one, and used her skills and resources to help underserved communities. Dr. Saw is the founder and CEO of Oral Genome, a point of care testing, a dental saliva testing company that aims in transforming dental prevention and early disease detection for providers and their patients. And if that's not enough, additionally, she has also founded Harmony Health Foundation, a nonprofit which is dedicated to advancing health equity and improving healthcare access for underserved communities. This is so awesome, supported by notable organizations such as Wells Fargo, America's Tooth Fairy, and several dental insurance foundations. Harmony Health Foundation has made a significant stride in its mission. Dr. Saw also collaborates with various states on public health projects through the Harmony Health Foundation, furthering her commitment to community and outreach. Welcome again, you, Dr. Tina Saw.
Thanks. You made me sound really good.
Well, because you are really good. Look at the number of things you're doing. I mean, most dentists in our lifetimes, we kind of do one thing, but then you took it up a notch. You have branched out into so many different areas that really need help, and you were able to visualize that, really early. And kudos to you for that you
Thank you.
know? Yeah. You thought beyond the operatory, Tina, and that takes a certain kind of mindset. That kind takes a certain kind of grit. And it's just amazing that all of that is combined in one person. And that's you, really. So it's an honor. So tell me a little bit about your entrepreneurial journey. What uh, experience or moment sparked the idea for All Genome, right? And what challenges did you actually face in turning that into a reality?
Well, I would say COVID was like a big turning point for me. And I remember I was in my private practice and I really just started a private practice because I was actually really tired of working for different people. And I wanted this boutique chic practice by the beach. I don't know. It just sounded like a really good idea. And so in 2015, I graduated school in 2014 from Loma Linda, and then 2000 for the year I was working in the same time I started building the foundations of my practice, and I was like, I'm gonna make it so much better, make it a good patient experience, make it where we're really honing on prevention and we're not really we just really are just providing good care for whole care for everybody. So I was running that practice for a couple years, and then we all know in 2020 that's when the pandemic hit. I mean, at that time, I was doing very well for a small boutique practice. And I was working about 5 days a week. And then when when the announcement came with, California Dental Association, the ADA, the CDC, we were going to be shut down for 2 weeks. And that 2 weeks actually extended to 3 months. And so I sat there pretty bored working on projects, but I also had a lot of time to like reflect. And I started thinking, hey, our profession is really into fixing problems. And when I went to dental school and I talked in my interview, why do you want to be a dentist? It's because I want to give people a good smile. I want people to be a really good, healthy person. I want to follow families. I want people to get good prevention. And that kind of changed because in dental school, we were always about learning how to do fillings, fixing teeth. And in my practice, I was getting a lot of patients that were asking about like, how could I prevent this? I don't understand why my son has more cavities and my daughter doesn't. They eat the same things. What products could I use? And I noticed a lot of times reps would come in, they would just, maybe it was the Crest and Oral-B rep. And so that was the product that our team had pushed out. But there needed to be some real science behind the reason as to why, and patients were asking for that prevention. And so there were a lot of like things out there, and I looked at saliva testing because in medicine, we are doing testing. You go to the doctor's office, you get your blood draw, you get your COVID test, your pregnancy test, your strep tests. And a lot of the tests out there in medicine, they had the luxury of point of care tests. You get your results the same day, within that hour of the visit. And I was like, what if we brought that into dentistry and we brought it at a very affordable price? And so that's what I did. So I started doing a lot of research during the closure in COVID on what technologies were out there and how I could make this happen in dentistry. And I started growing that team to do so. So that's kind of my origin story with Oral Genome and why I founded it and how it came out to be. But I have to credit a lot of it to the pandemic where I was at home doing nothing, because if COVID didn't happen, I'd probably still be in my practice full time and doing the same things and kind of being bugged about like why we haven't changed how dentistry is done today and helping patients better.
Right. Yeah, no, that's so amazing. I tell you, COVID has changed our lives in many different ways, right? For some people, it changed the way they practice and dentistry, that is. And in some people, it sparked what do you call it? A hunger to find a solution for problems so that we can make patients' lives better. So kudos to you for taking that time and using it so constructively in doing research to find better ways to help our patients. Because, Tina, if you didn't think about that, we wouldn't have what you have today, which is freaking amazing, really.
Thanks.
So, how does oral genome differentiate itself in the market? Can you share how your business model, specifically addresses the unmet needs in dental care?
Yeah, I mean, we really are a point of care test. And what point of care means, it's chair side, it's immediate, and there is no hassle of mailing it in, mailing it out, and only getting a certain number of results, only for perio, only for caries, or whatever it is. We are a one-shot test. We're a multi-assay, multiplex assay that is on one card. The other differentiator is that we don't have an expensive machine that sits in your dental office. You're going to get real-time results by using your smartphone. It's just like taking a mobile check deposit. You get your check, you put it on the table, you snap a photo, and the funds get deposited. But for us, you snap a photo and you're going to get your results. We're analyzing your saliva through the smartphone camera. So we built a really proprietary software that actually is reading the test and getting and giving you those results right away that you can just review at home or your provider can review. So I would say those are the two main differentiators. The other thing too, is being a point of care test, there is no degradation of saliva. I'm such a nerd, but I played with saliva during COVID, probably not a smart idea, but I did test it out where you test your saliva out, coming out of your mouth, what bacteria is there. Then you wait 15 minutes. Some of that bacteria dies, 4 hours, there's a huge drop in what's in there, in the integrity of it. So when you do a point of care saliva test, you're getting the most pure results right away and the most accurate results. So those are the couple differentiators that why, people are coming to us at Oral Genome.
That's really awesome. That's really awesome. Yeah, and I can't wait to get my hands on it, really, because that would be just so cool. So I'm waiting with a bated breath. And let's talk a little bit about your foundation, right? So the Harmony Health Foundation, as a founder, what objectives did you set out to achieve this with this nonprofit? And how does that complement the goals of Whole Genome?
Yeah, I mean, I've always had a really big heart to helping people that were underserved. In my dental practice, when I only had that, I would always bring in a patient in my practice who couldn't get dental care or afford it for some reason. And I would do a full smile makeover for them. I did this once a year. And like, for example, we did once on a homeless man. We got picked up by CBS, which is really awesome. And they filmed the entire journey where it helped him actually get a new smile, new teeth, get him a good job because people judge by looks. But the thing is like, one of the things is in my practice, I could only do one patient a year, something like this. And I was like, how can we impact people at scale? And so that came the idea of Harmony Health Foundation. I have this technology, which is Oral Genome. There were other dental technologies out there. I was like, what if we bring all these technologies together and then work with different other organizations to actually implement all these merged technologies into underserved communities. So today we work with the IDD population, so people with intellectual developmental disabilities. We work with these groups. I'll start with that. So we work with them and we work with American Institute of Dental Public Health. We study at Harmony Health what those health inequities are. We do a lot of mystery shoppers. We find out, okay, what are the challenges? Because people talk about the challenges and we listen to the customer voice
Mhm.
of these populations and also like the parents, the caregivers. What is the problem? And then we're finding a way to tackle that problem. And nobody
Wow.
has really done that before. We talk about it, but nobody's done that before. We do
Right.
that. So we've started in the IDD space because I have a child that's on the spectrum and it made sense to me to understand that. And
Right.
then we are, now working in aging, maternity. We're tapping into all these populations where these people typically don't get care very easily
Yeah.
because there's a lot of excuses that are out there. Like I know there's sometimes dentists, and at first I wasn't, I'll be honest, is like, how do you treat somebody with IDD? Like what accommodations? But if you do it right and you have the right technologies and you actually also focus on some home care techniques
Mhm.
and bring it to where they are, you can actually make a lot of impact. So, yeah, so that's kind of a little bit Harmony Health. Like we started in August and of 2023, and we're working with a lot of different organizations to make this all come together.
Wow, I can't wait to see the fruits of your labor on this one because really, as you said, a lot of these populations are sidelined in terms of the care they get, both in medicine, dentistry, or even the other allied health sciences. And it would be great to start bringing services to them in, using technology. And now with all these technologies out there, you are actually really amazing in even thinking about this and starting to get people together to work together with these communities to raise them up literally, and
Yeah.
that's pretty awesome too. So Tina, man, hands off to you. You're really kicking it here. So, what have been some of your key lessons that you've learned in leadership, especially about leadership while building in growing a startup, especially in this healthcare space, because it's crazy.
I think the biggest lesson learned is I'm not a superwoman and I can't do everything. Like I've really embraced my weaknesses and I ask for help. And I know I am not the top scientist. I am not the top person in operations. Um, and I bring in to me, the lesson for me was bring in the people, like they can be employees, they can be advisors. I rely a lot on my advisors too, that will fill in those gaps for you. Like that you don't make, like I don't believe in making up stuff. Like I don't fake it till you make it. I actually try to make it happen and bring in those right people in those right conversations and to deploy the projects that we're working on because I'm no superwoman and I'm fine with letting it go and just saying, "Hey, I can't do this. Let me ask this person for help."
That's very important. I think as entrepreneurs, you and me both, we need to understand both our capabilities and our vulnerabilities, and also understand what we can and what we cannot do, and then kind of outsource, rely on teams, rely on people who are better in have better knowledge and skill in whatever space that we are working on to actually have a finished product that's, better than what you and I could ever envision, right?
Yeah.
So I completely agree with you. That is very, very key in entrepreneurship, I think, is understanding what your capabilities are and then outsourcing or relying on other team members, and empowering them to help you in your mission. I think that's really great that you have been able to understand that, and I'm also understanding that as practice by numbers is growing. And I also have been relying on a lot of team members, on a lot of the dental community itself, and to help do what I can't do, because we can do what we can do, but then after that, you kind of have to let it up for the rest of the world to pick it up and take it from there, right?
Yes.
When you call, the universe does answer.
You know what? It is very true.
As long as you lead true from the heart, I think the universe does answer. And more than anything else, the dental community. It's been amazing how much support I'm sure you have also received, and I have received from them as entrepreneurs, where they have said, "Hey guys, we got your back," you know?
Yeah. Yeah, absolutely.
Yeah. So I see the love that you get. So that's really great. Now let's have a fun question, yeah?
Okay, let's do it.
I know that you've been on that show, Nailed It, right?
Uh-huh.
It was all about stepping out of your comfort zone and embracing like unexpected outcomes. Can you share a similar nailed it moment in your entrepreneurial journey where, taking that risk has actually led to like a really cool but unexpected outcome?
Gosh. Yeah, so the nailed it trophy is like right there.
You
The hat is like right there. And
gotta wear it, girl.
I know I should have just wore it for this podcast here. So nailed it was one of those things that just pushed me out of my comfort zone. Like you just don't know what you're thrown at. Like they'll like literally I remember them just like, okay, make this. And like literally it's like you look at it for like 5 minutes and you're like, oh my gosh, I don't even know how this is even possible. But anyway, I feel like looking back at it, oral genome, the whole entire journey, I don't even know what I was thinking. Like I was like, why don't we just have a point of care test where you snap a photo like a mobile check deposit and then you're gonna go and get like your results right away. Like if you think about it, that was a crazy idea, but I don't know why I did it and brought in the right people to like go and figure it out. So there was a lot of unexpected hurdles when it came to developing the product. I mean, we had to get the right antibodies, we had to grow them, we had to get them to go on the right place. Like it was like, it's like crazy. And then we had to determine the detection levels and how we're gonna, how sensitive it's gonna be. Then how to talk to like our software team that we were developing. Like I now I think about it, I'm like, whoa, that's like a lot. And that's why it took us since 2020 to get this technology off the ground. And so, I mean, I kid you not, as soon as I got through one challenge, it was like, oh, it opened up another challenge. And then
Mhm.
it opened up another challenge and another one. And so I feel like this is like nailed it, but like a 4-year nailed it.
It's a long-term nailed it.
Yes.
Girl, I'll tell you one thing, you're nailing it. So don't worry about it if it's taking time. Sometimes it takes a little bit longer than the 5 minutes,
Yeah.
to get where you want to go. But especially when your dreams are big, right?
Yeah.
You're literally putting, how do you say it, one nail at a time,
Yeah.
to
Yeah.
build something bigger than yourself, right?
Yeah. Yeah.
And that takes time.
Yeah,
So,
especially building, I mean, nailed it. You're building something novel and new out of your own two hands. And that's exactly what we did at Oral Genome. There was nothing that we bought right off the shelf. It was
mhm,
everything was created, and
mhm,
every component had its own engineer that created it. And
mhm.
then we put it as one seamless product.
Right. Yeah, that's the thing that a lot of people want to understand is, or need to understand, that in the entrepreneurial journey, it starts with an idea. Absolutely, yes. But to take that idea to fruition, there are so many minds and so many hands that actually go into it, that in itself, it's an exercise, it's a what do you call it, test for most of the people who are entrepreneurs in themselves to hang in there, to take that idea to fruition. And you have literally, I mean, I have been a witness to your journey right from the beginning. And you really have been, standing firm in your belief, working day after day, moment after moment, to slowly try to move forward, to bring forth this amazing vision that you've had. And I've actually witnessed it, and I think it's just I keep thinking, hopefully Tina's okay because she's got a lot on her plate. And I really, if there are women uh, who I really look up to, I think definitely, Tina, I must say you're one of them, because you have
Oh,
been seriously working so hard, so relentlessly in the pursuit for health and happiness, that it's something that all of us should really, we salute you to that. It's really amazing.
oh, thank you.
Yeah. No, I mean it. I mean it. Because I've been the witness from the beginning, I know all the pain that you have uh, endured, and you're still smiling. So, that in itself is amazing. How, if we want to contact, if our listeners and viewers want to contact you or learn more about both Oral Genome and Harmony Health Foundation, or help support you in any way, how can they reach out?
You can actually reach out on our website. We have an inquiry box that's checked every day. It's worldwideweb.oralgenome, ORALGENOME.com. Really stay tuned to that because we are in the midst of possibly launching some more stuff. And then
No
also
way, more stuff.
harmonyhealthfoundation.org is our nonprofit. Part of the profits that go from Oral Genome actually get donated to Harmony Health to help support a lot of our programs and implementation out across the US. We're in a couple of states that we're working in. So please, and if you ever, want to actually be part of Harmony Health or be one of our support clinical sites, volunteer, please contact us there because we really believe the more we have in this together, the more we can grow and really make more impact on everyone.
All right. There's A to impact. Well, thank you, Tina. It has been a pleasure having you on the Practice Pulse podcast. And it is, of course, I love you. And your journey has been so far amazing, and it's going to be even better. And I am incredibly honored to be a small part of your entrepreneurial
Oh.
journey. So, once again, thank you, Dr. Tina Saw, and we will definitely keep going and keep checking in to see where you're at because there's so much you're doing, and I'm so excited to find out and keep in tune with what's happening both with Oral Genome and the Harmony Health Foundation. Thanks
Oh,
again.
sounds good. Thank you.